Okay, so anyways, tonight what I wanted to do was talk about what is normal after baby. I should say normal in quotes, because really, is anything truly normal? Not really. So I get asked this question all the time by women, and I just feel like it's not something that we commonly talk about. Everyone is really focused on pregnancy and prenatal care and what happens with baby, and then all of a sudden you have baby and that's it. There's not a whole lot of aftercare for mom, and it can be really confusing because everything is totally different and totally new, and it's really hard to know, what's normal, what's not normal, what to expect. And everyone's experience is different. So sometimes that makes it really hard, because maybe what your friend or your sister went through will be completely different from what you're experiencing. So what I'm going to go through is kind of what to expect postpartum, and like I said, what's normal. But these issues, I want to point out, everything I'm going to talk about is common but not normal. So many women deal with these issues, and that's why a lot of times it's kind of become commonplace, like, haha, you're mom, you're going to pee your pants now. That's not true. That's not normal. But because it happens to so many women, we've just kind of accepted it as a normal thing. So I just want to really point that out. And I also want to point out that no matter where you are in your postpartum journey, these issues aren't normal. So if you're tuning in and watching this right now, I want you to know that even if you are 4 weeks postpartum, or 4 months postpartum, or 4 years postpartum, all of this is applicable and will apply to you. So feel free, if you're watching this live right now, feel free to drop stuff in the comments if you have questions or comments about anything I'm saying. I would love to get your feedback and hear it, so let me know. I'm going to jump in right now. So the most common issues that I see postpartum after baby would be any kind of leaking. So that could be your urine or feces. Urine is the most common, but neither are normal. So that includes coughing, sneezing, jumping, running. All of those activities you should be able to do without leaking. So everything I'm going to list out are common issues that are not normal. So if you're having any of these, please know that this is not how it's supposed to be. So as I said, leaking is a big one. Urgency. So urgency is where it kind of hits you out of nowhere and you're like, oh, I have to get to the bathroom like right now, or I might have an accident, or I might not make it there in time. That would be urgency. Oftentimes that can come along with certain triggers. So maybe it's every time you pull into the garage in your car, you get that urge, or every time you walk into Target, you get the urge that you need to get to the bathroom. Also not normal, and that kind of goes hand in hand with frequency. So people that have urgency tend to go to the bathroom more often. The third one would be any kind of pain with intercourse, or pain using tampons, or pelvic exams. So that would all kind of be lumped under the same category of pelvic pain. Not normal, especially after baby. So I don't know how many of you have been told, like, oh, the first time after baby is going to be really bad. I hear that a lot. That's not the case. It really shouldn't be. I always tell people maybe the first time is a little uncomfortable. It's just different. You're nervous. There's a lot going on. There was a lot of changes. That would be pretty typical. But if you're having any kind of pain, or if that's persisting, any kind of like burning, stabbing, sharp, shooting, pulling, anything like that is not normal at any point after that having baby. So please, if you're having those issues, don't wait months or years. not normal. More time is not going to make it better. Number 4 would be any kind of pelvic pain. So particularly, I wanted to really focus on pubic bone pain, the pubic symphysis, so kind of right above groin, right below belly. If you're having pain there, especially pain with like walking, standing on one leg, that's not normal. There are a lot of things that can happen during pregnancy and during delivery that can impact that area and can actually be very debilitating, where you're maybe not even able to walk. You need a walker right after delivery. Obviously on the lesser end of severity, you're functional but having pain with all these movements. So again, that's not normal if things are lingering. Same goes with like hip pain, low back pain. Anything that's lingering and hasn't resolved within those 6 weeks postpartum really isn't normal. Then number 5 would be any kind of heaviness or pelvic pressure. So when I say heaviness, kind of a feeling of like bulging on the pelvic floor, or some people will say it feels like things are falling out. Those are all indicative of a pelvic organ prolapse. So any kind of pressure in that area that you're feeling, especially with more activity or walking or squatting down, that would be something to kind of seek help with. I also added diastasis on this list. So for those that aren't aware, any kind of abdominal separation, so that's down the midline, you can get kind of this bulging or doming, coning. Those are all ways to describe it. When you do kind of like a sit-up movement, it'll bulge up in the middle. That would be indicative of a diastasis. Also, a lot of women will notice like a lot of abdominal distension. Like it looks like they're really bloated all the time, no matter what they do, it doesn't change. So like months postpartum, years postpartum, they're still dealing with this issue, and oftentimes it's because of a diastasis that has gone untreated. I also want to really point out on this, so a diastasis is technically 2 finger width or greater, so about 2 centimeters. Some people will say, oh, mine's not that bad, it's only 2 fingers, or it's only 1 finger width. Really, any kind of separation can be problematic. So everyone's different. Sometimes someone that has a 2-finger separation has a lot of dysfunction versus someone that's maybe 4-finger. I think the largest diastasis I've had is about 6 finger width. So it really depends on the person. We also look at the depth of that separation with how strong that connective tissue is. So I just want to point that out. I hear that all the time. People have been told from their providers that they were checked for it, but oh, it's not that bad. It's only like 2 fingers. There's a lot more that goes into it, and really any separation there can impact the stability and the function of the trunk and pelvic region. And then lastly, for all of you C-section moms out there, if you're having issues with your incision, so pain, numbness, kind of burning, electrical sensations, all of those weird feelings are really common, but not a normal thing. That basically is because of scar tissue and all of the connective tissue that's kind of all jumbled up with that incision. A lot of times we see people with a C-section incision, and it can actually tether onto the bladder and other organs. So really having that scar tissue looked at is pretty important. It can impact a lot of things. So don't discount it if you're having discomfort on that incision. Yes, it does take time to heal, obviously, but once things are healed and closed up, there aren't any scabs on that incision, being able to start some mobilization of it and getting some regular mobility of that skin and connective tissue is a good thing. You want that. It shouldn't be rigid and tight and anything like that. So those are the most common issues I see after baby. Basically, the recommendation or the guideline is anything within 6 weeks postpartum is kind of up in the air. You kind of get a free pass for 6 weeks. So, for example, incontinence, anything after 6 weeks postpartum is considered abnormal. The reason that you get a free pass, if you will, during those 6 weeks is because everything is readjusting, healing. There's a lot that went on, and so sometimes it takes a couple weeks for things to just settle back in. And during that time, there can be some issues that happen. I always tell people if the issues are happening past those 6 weeks, then it would be considered not normal. It would be something you'd want to address, not just give more time to or deal with it, because oftentimes it's not going to change at that point. I will say, though, that sometimes women have issues that pop up within that 6 week window that can be really debilitating. So I mentioned, for example, a patient of ours that injured her pubic symphysis during delivery and couldn't even walk. She needed a walker, couldn't get around the house. That would be something that we would want to help with right away, not just wait 6 weeks. Another example is a patient of ours that had a pretty significant prolapse after delivery. So it was to the point that she couldn't even stand or walk for longer than 5 minutes before feeling like everything was falling out. So, if you're having any of these issues within that 6 week window, but it's really impacting your function or your ability to care for baby, anything like that, definitely don't just wait. I would definitely, call your provider, seek out help with a pelvic floor PT, because it can be really limiting, and we don't want that. I also want to say that, I kind of said it before, but everybody is different and everyone's experience is different. Their bodies respond differently to childbirth. Everyone's had a different delivery. So, what has happened to maybe a friend of yours could be very different from yours. Same with, let's just say, incontinence can present so differently. Maybe one person only has it when they're coughing and sneezing. Another person only has it when they're bending down to pick up their baby. Another person only has it when, in the morning after drinking coffee. There's a lot that factors in, and so just because it's different doesn't mean that these issues are all okay to keep dealing with. So the reason that we can get some of these issues, I think it kind of helps to kind of understand how the whole birth process can really impact postpartum. Because a lot of times people say well, I didn't have any issues before, why is it now? Or especially women that maybe had a C-section that are leaking or have a prolapse, and they're like, I didn't even deliver vaginally, how am I having these issues? So I think it helps to understand. So a big thing is any kind of pre-existing condition, prior to pregnancy, it can be worsened from pregnancy. Pregnancy is essentially a stress test for your body. And those issues can kind of come to light. So potentially, maybe your pelvic floor was a little bit weaker before pregnancy. You didn't have any issues. You were able to do everything without leaking. But then pregnancy happened, and now you're leaking every time you jump. So oftentimes there was kind of something brewing. You just didn't know it. You weren't symptomatic. It wasn't an issue until it is. So that's one part. any kind of scar tissue. So if you had a vaginal delivery and you had any kind of tearing at all, you're going to have scar tissue. It's your body's natural way of healing. So that scar tissue can really impact the function of the pelvic floor, and it can also lead to a lot of pain issues. So most of the time when we have painful intercourse, it stems from scar tissue. And also what happened during childbirth. So all these things factor in. How long did you push for? Longer pushing phases are kind of put you at risk for a prolapse. If you had any kind of forceps or a vacuum delivery, can put you at more risk for prolapse or tearing with scar tissue, a nerve injury. If you had a C-section, all of these things factor in. And so really looking at what happened during delivery can kind of give us a good picture as to maybe why you're having the issues you're having. And then, like I just mentioned, a nerve injury, also very common. I read a statistic once that said 80% of women had a nerve injury after childbirth. So basically the nerve gets stretched so much that it can't do its job. It can't fire and tell the muscle what to do. So nerve injuries are really common, but then the muscles can't work, and we're going to have issues with leaking, urgency, pain, all of that stuff. So that's another big one. And so lastly, I just want to say that a lot of people kind of ask, like, well, I had no idea, or why didn't my provider like screen for this or look for this? And so I just want to say that a lot of times providers, they don't always screen for these issues unless you bring it up or you kind of ask them about it. And it's not necessarily that they don't want to, or it's not important, but they're kind of dealing with the entire medical side of the postpartum recovery, and all of these common issues, they really fall more into like the musculoskeletal arena, if you will, which is a lot more my arena than theirs. And so they might be able to screen for it, but they're also probably not as knowledgeable about a lot of these issues as someone like I am, or like any other pelvic floor PT is, because that's kind of our area of specialty. And so I think that's kind of sometimes where discrepancy comes into, is because, women aren't being screened for these things as kind of a standard. And then if they are, it's oftentimes not by a pelvic floor PT, it's by an OB or a midwife or someone else on their, pregnancy care team that is maybe not quite as knowledgeable on how to do that properly. So that's also why, when we have patients come in that were told one thing, so for example, they were checked for a diastasis and they were told, oh, it's only, 1 or 2 fingers. And then they come here and we tell them, well, no, actually it's 4. That's where you can get some of those discrepancies, because everyone's different. There's always going to be a little bit of room for error between providers, but we're really trained specifically in these things, and that's not really what they're focusing on. So if you kind of run into that issue, that's why. It's not that anyone's wrong or anything like that, but there's just differences in specialties. So that's really why, ideally seeing a pelvic floor PT after delivery is super important, because we can assess for all of those things a little more thoroughly and kind of set you up on a good game plan so that it's not years from now and you're still not able to have sex. So If you kind of want to see where you stack up on what's normal or not normal, check out our Pelvic Health Quiz. I linked to it in the description. It kind of asks you, I think there's about 9 questions on it, and it asks a variety of topics, and then it grades how healthy your pelvic floor is. So if you're having some issues, you're still not really sure, check out that quiz and see kind of where you stack up, and it also gives you some tips and resources too with what to do with that information. So thanks for watching. I hope this was helpful. I really hope it cleared up some common questions and misconceptions with what's normal after baby and what to expect. So have a great night, everybody, and I will see you soon.